Hello friends, today I want to share with you our experience in some of the prostate massage devices. We use prostate massage actively for the treatment of prostatic inflammation, prostatitis. And when we do a prostate massage with our finger, of course, the continuation of the massages are making a problem. Some of our patients are coming from long distances and they have to continue their massages themselves. So we use prostate massage devices for these. I previously made a video of this soft sonic device and show it how it's working. Today I want to add a new device which is a difficult name, New Flora. This is some kind of a women's device, but it's also used. And this is Dr. Joel's device. We are most commonly using these devices. Why we changed this device to the others? Some of the patients were not very happy with this one. And I thought that we need a bending end to push the prostate in a better way. Because as you see, this device and also this device, when they enter inside, they cannot squeeze the prostate as much as we want. So the best thing about these, they are vibrating. Let me show you how they vibrate. So the mechanism of action for these two devices are vibration. For this device, also some press on the prostate. Let me show you how it vibrates. Look at this device. It makes a good vibration, but this slight notch at the end of this device sometimes makes it superior to this device, but the vibrations are better in the device. Let me show you the vibrations. The vibrations are more soft. You can also vibrate the back part. And at that time it becomes more vibrating. And when it touches the prostate, this little notch at the end makes it able to squeeze the prostate a little bit. Of course, not as much as this device. Oops, let me show you. This vibration is more. Yeah, this device is with this bending end can squeeze the prostate better. But the problem is, compare the thicknesses. This is very thick. This is in the middle, this is the thinnest. So it's more comfortable to insert. At what position do we have to insert these devices? Let me show you how we will do this. Okay, this was our favorite position in this prostate self-massage technique. Using our finger, we can do a self-massage in this position. It's easy for the hand to enter into the toilet. But with our massage devices, especially these large devices, they hit the toilet borders and they cannot be used at this position. So we have to use other type of positions. Bending position is good. In the bending position, you can put the device into your anus. As if you flex your knees slightly, let me show you another slide. If you slightly flex your legs, it can be a better position. And in this position, you can touch your anus, feel the anal sphincter, and try to push the device inside gently. So this is a good position that can be done in this position. I will show you another position. Okay, this is dorsal recumbent position. In this position, you lay down on your bed and bend your knees. And in this position, you can touch with your left hand to your anal sphincter, find it, and with your right hand you can put the device inside. This is Fowler's position. If you flex your hip joint a little bit, raise the upper body up, this is easier. Of course, you have to flex your knees. And Sim's position is that position. Also in that position, you can touch to your anus and find it blindly, and you can put the device inside. So, our aim is to put the device into the rectum. You can put it that way and turn, and then you have to push the prostate this way. So push the device upwards in the opposite direction, and you will try to compress the prostate as much as you can. As I say, in this device, it has a straight end and it's not easy to compress with this device. But the vibration, as I show, when you touch any part of the prostate, it makes some action. So I can say one device is better than the other, but there are some advantages and disadvantages. This is vibrating really harshly. This is a softer device. Its vibrations are softer. But anyway, when you put inside, if you touch any part of the prostate, all of the prostate will shake. So this device works with an AA battery here. This device has an electric charge plug. You don't need any battery. All of the devices, not all of the devices, these two devices are waterproof. When I push in a long period, it starts. Push it again, it stops. And it has some different type of shakings, vibrations. You can push and change the modes. And here in this device, here are the batteries. It works with AAA battery, thinner and smaller one. And the battery is closed this way, and there is in the tip there is another button. Actually, the shape of this is good. You can squeeze the prostate, but my patients sometimes has some concerns about its length, because prostate is maybe 8 to 9 centimeters inside, and when you push 9 centimeters, half of it you have to push inside. They say sometimes they don't have much space to hold, but in this device you see you can insert a lot more distance, and still you have this handle to control the device. And also this device is longer than that one. So it's a little short. For me, if this device was thinner, as thin as this, and if it was a little bit longer, I would recommend this as the best device. But now I don't have any recommendation. You can try all of them, or if you want to start at once, maybe you can start one of these two. So that's what I want to share with these devices. Any of these, with the vibrations they made on the prostate, helps us really dramatically in our treatment. We have the Prostatitis Protocol. This is it's composed of prostate massages and some antibiotic treatments, some other phytotherapies, such things, but the main part of it is prostate massage. So we ask the patient to come for 5 days, and we do prostate massage every day. But afterwards, when the patient returns back to home, he needs some continuation of the treatment. So we recommend him to try to do the massage himself. Some of them can do it, but they cannot press as with the same power we press. So they complain about it. Or some of them really cannot reach the prostate because the anatomy is the length of the prostate and anal distance is too much. The prostate is located high. So these devices are helpful for this to solve this problem, and they can reach any part of the prostate, and even touching to some part of the prostate and shake all of the prostate with the vibrations is good for our treatment, good for our therapy, and the prostate massage is a good solution for prostate inflammations. Thank you very much for listening.